Hello and welcome to the YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. I am your host physiotherapist Meghna Dave, and in today's video I would be talking to you about proprioceptive neuromuscular facilitation method for the management of Bell's palsy. How this technique is helpful, when it should be used, when it should not be used, and to what extent it is helpful for you. I'm going to explain you that in this video. So if you are interested in knowing about various techniques and methods that are there to help you to deal with your Bell's palsy, these series of videos are definitely going to be helpful for you and informative for you. So make sure to subscribe to this channel so that you can get notified every single time we upload a new video. So let's begin today's video. Proprioceptive neuromuscular facilitation technique has been used in different setups across the globe and is one of the very popular method of rehabilitation of patients, not only by physiotherapists but also by occupational therapists as well as speech therapists. PNF technique has been reported to be beneficial in improving the functions of the muscles that have been impacted due to some neuromuscular insult or else neuromuscular disorders. PNF basically aims at normalizing the muscle tone and improving the function of the muscles by using specific techniques like stretches, resisted movements, traction, approximation, and irradiation. Even though these terms might sound unfamiliar to you, the basic idea or its basic philosophy behind proprioceptive neuromuscular facilitation is to use the untapped potential of every human being and take the help of different stimulus that could be either auditory, it could be either vocal, or else it could be either through touch to activate those weak muscles and gain the results. These therapeutic techniques are widely used in sport rehabilitation setups, neurological rehabilitation setup, musculoskeletal or else orthopedic rehabilitation setup, and it has got good amount of positive results, and even many researchers have shown its impact, which is positive, and hence it's a very good evidence-backed therapy or else a treatment method for different muscular disorders. Now, what exactly is PNF? So basically PNF is not just a technique, it's a philosophy. It's a philosophy of taking the positive approach, utilizing the things that are intact in a patient and utilizing it to an extent that it helps the patient or else enables the patient to compensate for the lost movements or else limited movements. So if you look at the meaning of PNF itself, PNF P stands for proprioceptive, which means that gives information to the brain concerning to movement, position or body. Neuromuscular stands for involving the nerve and muscles. Facilitation stands for making movements easier. Basically, PNF therapy is an integrated approach that focuses on entire human being rather just focusing on one single area of impact or else impaired body part. So whenever a person is being treated with the help of PNF technique, the therapist not only looks at the patient only at the local area where the problem exists, but they take care of the entire body, entire system, and look at the patient in a holistic way and try to make them independent as much as possible. There are certain philosophies that forms the basis or else principles of PNF technique. One such philosophy is mobilizing reserves. The PNF technique believes in focusing on patient reserve, which means the areas which are good enough, are strong enough, and using those areas to replace or else to compensate for the impaired region. The second principle or philosophy of PNF technique is positive approach. PNF always believes in keeping an optimistic attitude towards the therapy, towards the treatment program, so that the patient as well as the therapist stay motivated while doing the exercise program. The third principle of PNF therapy is trying to achieve the highest level of function. Whenever a PNF technique or else PNF method is used in rehabilitation, the movements are based or is designed on the basis of function, not the movement as such. So for example, if we are trying to raise your hand, that's a movement. But when PNF technique is applied, that movement is replaced by the aim of trying to reach out to something, trying to hold something. And that's how this technique helps in functional training of a patient. Next is motor control and motor learning. According to PNF, in order to reach to the highest level of function, the therapist needs to integrate principles of motor control and motor learning. This includes treatment on the level of body structure, the activity level, as well as the participation level. Now you must be thinking how all these things applies to Bell's palsy. Bell's palsy is a neuromuscular disorder, which means due to impact on your nerve, your muscles have got weak and now they are not having that right potential to move. Based on PNF principles, the physiotherapists try to identify the areas which are strong, which are good, and utilize those areas to achieve functions on the affected side. The second principle of PNF technique is looking up towards the positive side, and that's what is our mission also. Whenever a therapist treats a patient with the help of PNF technique for Bell's palsy, both therapist as well as patient have to be optimistic towards the treatment program. Because if you are not optimistic towards the program, it's not possible to stay motivated for a long period of time, because rehabilitation process in general, be it PNF technique or any other kind of technique, are long-term programs and they need a lot of patience and need a lot of optimistic attitude. The next is using or else trying to achieve the functions to highest level, and also to use the functions as the core, not the movement. So basically, for example, in facial muscles also, when you lack facial control, you lack your expressions. So again here the aim or is the treatment program directs towards the functional return of the movement. What are the functions that are lost due to Bell's palsy? And the treatment aims at improving those functions, not improving those movements as such. So that's the difference in PNF technique and regular exercise program. Apart from that, there is also a big involvement of motor control and motor learning method. So motor control and motor learning is basically the principle which applies to any kind of rehabilitation process, where any movement needs to be first learned and needs to become as a habit for someone to use it for the day-to-day life. And keeping these principles in mind, PNF technique for Bell's palsy is also used. Now, PNF technique, how it is used in Bell's palsy cases. So PNF technique basically uses different methods with the help of stimulus, which could be either auditory, which means through voice commands, or else through your help of hands. So these are some guided movements, guided exercises with the help of hands, as well as your auditory stimulus, and even sometimes with the help of mirror feedback, and patients are taught to move their muscles in right direction. Patients are taught to have their expressions in right format. That's the entire program of PNF technique to improve the facial function. Now again, PNF technique is something that's helpful in reducing the severity of Bell's palsy by focusing on bringing back the facial movements. Yes. Now when it comes to Bell's palsy, there are two treatment sets. One is the set of treatment which focuses on recovering or is regaining the muscle strength of the weak facial muscle. Another set of the treatment is for those people who have got synkinesis, where there are hyperactive facial muscles and there are involuntary movement happening. Now, PNF is not very much helpful in synkinesis management, because here the focus is on training the right movement patterns, improving to an extent the strength and the direction of movement and the coordination of movement, right? So that's why PNF technique is mostly used in the early phase of Bell's palsy or else in the late phase of Bell's palsy, where synkinesis is either minimal or else does not exist. In short, if you who are someone who have got partial recovery from Bell's palsy, which means that your facial movements are not complete, but you don't have synkinesis also, which means you don't have any kind of involuntary movement present, at that time PNF technique would be helpful for you. Because here lot of stimulus, lot of mass movements, lot of resistance is used. Now, these mass movements, these resistance, when used in synkinesis, it can increase the synkinesis level also. That's why PNF technique is mostly helpful in the initial days where synkinesis does not exist, or in the late stages post synkinesis reduction. At that time, PNF technique is used to regain the strength of the weak facial muscles. So that's how this PNF technique is helpful. I know this is quite a complicated thing, but the entire purpose of mine making this video series is to educate you that when it comes to Bell's palsy management, it's little complex. It's not that straightforward treatment process based on what situation you are into, based on to what extent your nerve damage has happened, based on to what extent your synkinesis is there, based on what extent or as to what duration your Bell's palsy is into, different therapeutic techniques or as different treatment programs are decided. As I mentioned, in initial days of Bell's palsy, in the acute stage of Bell's palsy, where you have zero movement, electrical stimulation and facial massage is more important. Once you start regaining the movement but you don't have any kind of synkinesis, at that time, yes, PNF technique is very helpful. But after 3 months of time, if you are gradually starting to develop synkinetic movements, at that time you should first focus on reducing your synkinesis level. And once you reduce your synkinesis level, then again PNF technique needs to be started on to regain the symmetry of the facial muscle. And that's how the entire process or its treatment of Bell's palsy through physiotherapy program exists. So this is what my agenda of making this video series is to educate you and let you know what's the right process of treatment program of Bell's palsy. I hope through these videos you are able to understand that. If yes, make sure to like this video, share this video, and don't forget to subscribe to HealthQ channel. And I'll see you in another video. Thank you.